Hello, I'm Dr. Natacha Simpkins from Town & Country Animal Hospital, and today I'm going to talk to you about endocrine diseases in dogs. Endocrine diseases, once again, similar to cats, are conditions which cause a hormonal imbalance in the body and then disrupt normal bodily functions. Common endocrine diseases in dogs are hypothyroidism, Cushing's disease, Addison's disease, and diabetes. So hypothyroidism is an undersecretion of thyroid hormone. The common signs of hypothyroidism are weight gain, lethargy. Sometimes they're gaining weight even though they don't eat anymore. They are heat-seeking. Sometimes they lose fur symmetrically over the trunk, the back of the trunk, the caudal trunk, we say, behind the thighs and over the tail. And sometimes the skin becomes hyperpigmented. For hypothyroidism, it's very straightforward, similar to cats, in that we just, in this case, supplement their thyroid because they're not producing it. In cats, we take their thyroid away because it's too high. In dogs, we give them thyroid. There are oral forms of thyroid called levothyroxine that we supplement dogs with to get them to the appropriate range. Cushing's disease, which is an oversecretion of corticosteroids, symptoms of Cushing's disease in dogs. So essentially, we will see an elevation in one of their liver enzymes. And then owners will also generally complain that they're drinking a lot, urinating a lot. They'll also have, many of them, an increased appetite. And it's a dramatic increase in appetite. They're hungry, they're trying to get your attention before dinner time because they're so hungry. The other thing that Cushingoid dogs will do is they will transfer their fat to their belly. So they'll develop a pot belly. They also lose fur and they'll have a thinner fur coat. They're more prone to infections as well. In terms of treatment, so we diagnose it, sometimes we have those symptoms and then we have an elevation in the alkaline phosphatase. And so then we ask the owner to bring in the dog for further testing. And it's a blood test that we do to confirm a diagnosis of Cushing's disease. And then, depending on the type of Cushing's disease it is, because it can be pituitary dependent, or it can be an adrenal gland tumor that could be causing it. So if it's the pituitary dependent form, we treat that with trilostane, which is given twice a day generally in our practice. And then we have to recheck them in 2 to 3 weeks to make sure they're at an appropriate dose of trilostane. If they have the adrenal tumor form, surgery is the treatment of choice for that condition. In Addison's disease, it's an undersecretion of corticosteroids and mineralocorticoids, or sometimes it's only one or the other. Addison's disease and Cushing's disease, the problem is in the adrenal gland. Addison's disease can be a little tricky to diagnose because sometimes they just have off and on diarrhea or soft stool, and sometimes they're on and off lethargic if they have some sort of stress in their life. And so it can be harder to diagnose, but once again, if there's an index of suspicion for that disease, a blood test can diagnose it quite easily. And then in terms of treatment of Addison's disease, as long as they haven't gotten very sick from the disease, if they get very sick from Addison's, they need hospitalization in the acute phase of their illness. But in terms of long-term control, most of the time we'll use a small dose of a steroid, just if their body isn't producing any steroid at all. Sometimes we need to give them steroid. And then we also give them this mineralocorticoid, which is in an injection form, and it's given on average about every 25, sometimes can go a little longer, but every 25 days or so. So diabetes in dogs is a little bit trickier in terms of treatment, but diagnosis is very straightforward. So essentially they have an elevation in their blood glucose, and it's so elevated that the glucose is spilling into their urine, and so they have glucose in their urine as well. Signs of diabetes that owners will cause owners to bring their dogs in is that they're drinking a lot of water, they're urinating a lot. So they're starting to have accidents in the house sometimes. They're eating well, but they're losing weight. And once again, they'll have a ravenous appetite, so similar to diabetes in cats. But despite that ravenous appetite, they're losing weight because their body is not seeing, their cells are not seeing the glucose that they're ingesting because they're lacking insulin. So in terms of treatment, we provide them with insulin. We have to have owners inject them twice a day with insulin, and we determine the dose of insulin required based on glucose monitoring, and then we get them regulated with the appropriate dose of insulin. Diet is also important in treating diabetes, and there are special prescription diets that are best for treating that condition as well. In summary, endocrine diseases are treatable in dogs, and please don't be discouraged if your dog is diagnosed with one of these conditions, because there are really good treatments available. Thank you for watching this video. If you have any questions, please don't hesitate to reach out.